in. Hi, my name is Christine and I'll be your student nurse today. I'm going to wash my hands and provide some privacy for you. So could you tell me your first and last name?
Meghan Gall.
What's your date of birth?
3/15/1995.
Okay, Megan, do you know why you're here today?
For checkup.
And do you know where you are?
CHP.
Okay. What season is it?
Spring.
And today's date?
April 9th, 2015.
Okay, so speech and affect are appropriate for the situation. The patient seems calm and she appears her stated age. There are no signs of illness. Are you in any pain today, Megan?
No.
Do you have any allergies?
No.
Okay, so I'm just going to get started with my head to toe assessment. I'm going to first start with your head. I'm going to inspect your scalp. So there are no obvious lesions on the scalp, no redness, and no evidence of pests, and the hair is evenly distributed. Now I'm going to get started on the head. So skin is warm and dry, warm to touch, and there are no signs of lesions. I'm just going to check your eyes. So pupils are equal, round, and reactive to light. Could you follow my pen light? And they accommodate. I'm going to also check your conjunctiva. So it's pink and moist, and the sclera is also white. Now I'm going to have you puff your cheeks out, stick your tongue out, smile, frown, raise your eyebrows. And now could you close your eyes and tell me where you feel this?
Forehead, cheek, nose.
Okay. So cranial nerves 5 and 7 are intact. The face, the nose is midline and the lips are symmetrical. Oh, so now I'm gonna take a look at your mouth. Could you say ah?
Ah.
Okay, so the buccal mucosa is pink and moist. The gums are also pink and moist. There are no obvious signs of lesions. The teeth were white and straight with no dental caries, and none of them were missing. The uvula retracts and the tonsils were 1+. The tongue was also midline, and there were no signs of lesions on the tongue. So now I'm just gonna check your carotid pulse. Okay, so the carotid pulse is 2+, equal and bilateral. I'm going to take a listen to your carotid pulse as well. When you feel my stethoscope, touch your neck, hold your breath. Okay, take a breath. Okay, so there's no evidence of bruise, and the skin on the neck is intact with no signs of lesions. Now I'm going to take a listen to your heart. So I'm going to listen at the aortic point in the second intercostal space, in the pulmonic in the second intercostal space, Erb's point in the third intercostal space, the tricuspid point in the fourth intercostal space, and then the fifth in the mitral, the fifth intercostal space is the mitral. And this is where I would listen for the apical heart rate for 60 seconds. And then I would flip it over to the bell and listen in the mitral, tricuspid, Erb's, pulmonic, and aortic. So the heartbeat was regular and strong. I heard sounds at S1 and S2, and there was no evidence of a murmur. Now I'm just going to take a listen to your lungs. When you feel my stethoscope, just breathe in and breathe out. Could you lift this arm? That's okay. Lift this arm. Okay. Now I'm going to take a listen on the back. Okay, lung sounds were clear in all fields and there were no adventitious sounds. So now I'm going to check the costovertebral angle. Do you feel any pain?
No.
Any tenderness?
No.
Okay. And the anterior-posterior diameter is of 2 to 1. And so now I'm just going to assess your arms. So skin is warm and dry, and the hair is evenly distributed. I'm going to do your brachial pulse. Brachial pulse is 2+, equal and bilateral. Radial pulse is also 2+, equal and bilateral. I'm going to check for capillary refill. Nail beds are pink and capillary refill was brisk and under 3 seconds. If you could go like this, I'll check for clubbing. There are no signs of clubbing. Would you grasp my fingers as tight as you can? Okay. So now I'm going to have you lay down and I'm going to assess the abdomen. Okay, so the abdomen is there are no obvious signs of lesions. There's no scarring. The umbilicus is midline, and the patient also has a piercing on the umbilicus. The contour is flat, and now I'm just going to listen. Vowel sounds are present in all 4 quadrants. Now I'm going to percuss. So the right lower quadrant was tympanic, the right upper quadrant was dull over the liver, the left upper was tympanic along with the left lower. So now I'm just going to palpate. Is there any tenderness or pain? So in the right lower quadrant there would be the appendix and the cecum along with the right ureter, the right ovary and the part of the uterus for the woman along with the bladder and the ascending colon. In the right upper quadrant there would be part of the liver, the gallbladder, the ascending colon along with the transverse colon. There will be part of the stomach, the right kidney, and the part of the ureter. In the left upper quadrant, there is the stomach, the pancreas, the ascending colon, part of the descending colon, as well as the left kidney and the part of the left ureter. In the left lower quadrant, there is the ovary and part of the uterus for the woman, the bladder, as well as part of the ureter, the left ureter, the descending colon and the sigmoid colon, along with I think that's all of that. Okay, so I'm just going to have you sit up. Okay, and I'm going to assess the lower extremities. So I'm just going to have you pull your pants up. Okay, and I would assess, oh, the patient also has no signs of jugular vein distension. So I'm assessing for the popliteal pulse. The pulse is 2+ and equal bilaterally. The tibial pulse is also 2+ equal and bilateral. The pedal pulses are 2+ equal and bilateral. I'm going to perform the Babinski test. The Babinski reflex was normal for this patient. The capillary refill, her nail beds are pink, and capillary refill is brisk within under 2 seconds. So the skin is warm and dry, and the hair is evenly distributed. So you can put these down now. I'm just going to have you stand up, and I'm going to assess your spine. So you can bend over. So the spine is midline, and there is no evidence of vertebrae sticking out. Okay, you can stand up. Now I'm going to perform the Romberg test. So you can close your eyes, and we're going to see how you balance. Okay, and now I'm going to have you walk from the door to the wall and then back. So the patient's gait is steady and normal, and I'm just going to have you take a seat again. And the patient's skin is true to her ethnicity, and she has no obvious signs of illness. So this concludes my assessment, and the doctor will be in with you shortly.